What are the goals of the medical profession? Now, the first things that probably popped into your mind are your standard medical services: vaccines, routine checkups, and a slew of pharmaceutical drugs. Notice that what these services have in common, they have the goal of healing the patient. In one view of the goals of medicine, what is called the pathocentric view, claims that healing patients is the sole goal of the profession. Here, I have to be explicit about what I mean by healing, since not all services that address patient health issues are aimed at curing a disease. For instance, vaccines prevent diseases by strengthening one's immune system against them. So, on the pathocentric view, preventing unhealthy conditions is also within the scope of medicine. But medicine, according to the pathocentric view, does more than just prevent and cure unhealthy conditions. Medicine also reduces the severity of the bad effects of those conditions. There are many unhealthy conditions that cause pain or discomfort, but for which we do not yet have a cure. Most common colds are like this. When we take flu or cold medicine for the sniffles, we are treating the symptoms of the illness by, say, reducing your fever or suppressing your cough. So the pathocentric view of medicine claims that the goal of medicine is to prevent, reduce the severity of, or mitigate the bad effects of unhealthy conditions. Now, this seems like an initially plausible view. We don't think that you seek medical care to help you with your taxes, for instance. But the philosopher David Hirschnall provides a further argument for the view that medicine is concerned only with addressing the patient's health. He asks us to imagine a person who only ever uses her knowledge of the body to perform cosmetic surgeries and never addresses any issues related to patient health because she doesn't know how. Would we say that this person is practicing medicine? Probably not, and that's because this person is not serving the health interests of the patient and couldn't, even if she wanted to. On the other hand, imagine that all a person did was use her knowledge of the body to treat unhealthy conditions. Suppose that an OBGYN doesn't know how to perform abortions, but she is extremely knowledgeable about most areas of women's health. Since she can address unhealthy conditions related to women's health, we would certainly say that she's practicing medicine even though she can't provide abortions, since elective abortions are not related to the patient's health. Pregnancy isn't a disease, after all. Well, what about services like abortion that are not aimed at improving or preserving the patient's health? On the pathocentric view, such services are not, strictly speaking, medical services. Other services that are not aimed at improving patient health and are not therefore medical services on this view include physician-assisted suicide, lethal injections given to individuals on death row, sterilizations, and female genital mutilation. To be clear, a defender of the pathocentric view does not need to make the extra claim that it is morally impermissible to provide such services. All that this view claims is that there are good reasons, based on the goals of the profession, not to provide such services. The goal of medicine on this view is to heal patients, and doctors, therefore, don't have strong professional reasons to provide services that don't address unhealthy conditions. But that leaves open the possibility that moral reasons in favor of providing these services outweigh the professional reasons to refrain from providing these services. So, keep in mind that you could endorse a pathocentric view of medicine, and at the same time, think that the moral reasons to provide services other than those that address the unhealthy conditions of patients provide enough reason to provide those services in a medical setting. Thanks for watching 5 Minute Ethics. Please like and subscribe.